Thank you, Sonia. I'll unmute myself. Can you hear me now?
Yeah.
Okay.
Yeah.
So thank you. I'll just check my slide. So I'm delighted to present what are basically the final findings that are going into the paper that we're writing at the moment on the project that was funded by the CMRC through this initiative, with a specific aim of mimicking chronic fatigue syndrome using a model of inflammation-induced fatigue. So the principle of this project, and I'll give you more details in a second, is the idea that a lot of the difficulties in finding immunological dysfunction in chronic fatigue syndrome, or ME, is the fact that we observe biological changes occurring months or often years after the onset of the illness. And we really don't know what's happening early on in the course of the illness, perhaps at the time when there was an initial encounter with an effective agent, at least for people in which the disorders could be linked to an initial infection. So we therefore decided to use a slightly different models in which patients do develop chronic fatigue, and but a longitudinal model that allows us to look at what happens to this patient early in the course of the illness. So as I said, there is quite a lot of evidence. I mean, of course, we also have the paper from Montoya that was recently published, but with evidence kind of being sometimes not clear or not consistent about immune dysregulation at the time of the diagnosis or at the time of the clinical illness. But the problem we have had is this cross-sectional analysis. So the solution that we are proposing here is to use a clinical model, a naturally occurring clinical model, which is interferon alpha-induced fatigue. Now, for those of you who are not familiar with this clinical group, patients with chronic hepatitis C, viral infection, chronic hepatitis viral infection C, receive, until recently, because now actually new medication have started, in fact interferon alpha is almost no longer used, but until a few years ago, until recently, really with the last patient that we have been able to recruit for these studies, a patient would receive interferon alpha, which is a pro-inflammatory cytokine that profoundly stimulates the immune systems. And this stimulation occurs for 6 to 12 months. It depends. Usually quite a long treatment, depends on the type of virus that the patient receives. And the interferon alpha, as all situations of acute infection, induce both mood and fatigue disturbances acutely in the patient during the treatment. But most importantly, it also induces persistent fatigue in a subgroup of patients. So most patients, once they stop the interferon alpha, so once the immune challenge stops, their level of fatigue goes back to normal, or in fact improves for patients in which there's been also an effective clearing of the virus. However, data that was collected in 2010, so before we started the project, which really has inspired our project, showed that around a third, as you can see here, and this survey was about 38%, around a third of patients continue to experience clinically significant fatigue between 6 and, in fact, in this case, 12 months after cessation of therapies. So we have basically the possibility of looking at a model in which we can observe people before they have the immune challenge, at the time they have the immune challenge, throughout the immune challenge, and then once they stop the immune challenge, see which patient improve or which patient maintain or develop a persistent fatigue, which we think is a model of what's happening in at least a subgroup of patients with chronic fatigue syndrome and ME. So that's the study aims, really using interferon alpha-induced persistent fatigue, so fatigue that is still present 6 months after cessation of interferon alpha therapy, so when the immune challenge is no longer present, as a model to understand are there effects of immune system activation in patients with chronic fatigue syndrome that we can no longer see because they occurred really early, but still have an effect on inducing fatigue. So most of the data we'll present is about the samples, but we also, of course, recruited a group of healthy control and a group of chronic fatigue syndrome ME patients as a reference, if you like, group to look at how they, what are their abnormalities in relationship with our experimental group. So we have recruited a hepatitis C patient in a variety of hospitals, especially when they became rarer and rarer in terms of the treatment with interferon alpha. We expanded to many sites in London. We saw them regularly before, during interferon alpha, and then 6 months after the end of treatment. We also recruited 50 patients with chronic fatigue syndrome and 50 healthy controls. Now, the key findings, first of all, is that we were able, in fact, to replicate what has been illustrated in a survey. So it's the first time that this has been shown in an actual control clinical study, is that, in fact, about a third of patients receiving interferon alpha for chronic viral infection, so 18 out of 51, about 35%, develop persistent fatigue. So these are patients, they maintain, these are patients that maintain clinically significant level of fatigue 6 months after they stopped interferon alpha, when there is no longer any, if you like, biological immune activation due to which is completely resolved. So these are the patients, these 18 patients compared to the 37 who did not, so patients, if you like, who are resilient to the development of fatigue during an immune activation. So these 18 patients are the patients that we think are a model that we could use to understand chronic fatigue syndrome. So first of all, what do we know about this patient? So now we've been able to track the course of fatigue throughout interferon alpha and at the follow-up. So let's start backward, if you like. This is the time that we make a diagnosis of persistent fatigue. And the red line, the pointers, okay, so the red line indicates the persistent fatigue. And of course you can see this is the fatigue level, so you can see the fatigue level in the patient with persistent fatigue obviously are higher than those without. What's interesting, 2 points I want you to kind of stress in these slides. First of all, that at the baseline, so before they even start interferon alpha, there's no difference in the fatigue level. So in other words, it's not that people who, after interferon alpha and 6 months later have higher fatigue, they had it before. At the beginning, there's no difference in that level of fatigue. They all start at the same time, in the same way. However, during the immune challenge, in fact, really early in the course of the immune challenge, during the first 4 weeks of interferon alpha, a group of patients really increased in the level of fatigue. You can see that both of them increase fatigue, and we know that acute fatigue is present during interferon alpha. However, one group really shoot up. And these are the ones that remain fatigued throughout interferon alpha, so you can see the following time point, and still remains fatigued at the follow-up. So there's something happening really early in the course of the immune activation, which makes this individual more fatigued and predispose them to maintain this high level of fatigue throughout, even after the immune challenge has been removed. And we think that, again, that mimics or tells us something about the sensitivity of patients with chronic fatigue syndrome ME that probably just respond more to the initial immune stimulation, probably due to a virus infection, or sometimes an immune stimulation related to an acute stressful life event. They just respond more with acute fatigue, and I'll show you in a second also biologically, which may explain why they then go on to develop persistent fatigue and chronic fatigue syndrome. Now this is mimicked by looking at physical functioning. So this is an item of the SF36 that just shows change in physical functioning before, during, and after the interferon alpha. There is a drop in physical functioning overall in patients during interferon alpha. This is because they experience, as I said, fatigue in general and mood changes. However, again, parallel to the fatigue changes, those who go on to have persistent fatigue also have more acute fatigue. They also have more impaired functioning especially early in the course of interferon alpha, and then of course throughout the treatment and so follow-up. Now, as I said, we also recruited chronic fatigue syndrome in healthy controls. Now, we also measured immune function, because obviously, you know, the whole model is about trying to understand how does the immune system changes in this patient during the simulation with interferon alpha. And is there anything signal that we can measure in the blood that tells us who are the patients that go on to develop persistent fatigue and who are the patients that are resilient to do not develop persistent fatigue. So I'm going to show you some results. I'm first going to kind of tell you the results, and then I'm going to show you graphically. This is what I think is the, if you like, even the most exciting part of the study. So first of all, baseline, so even before starting interferon alpha, there is a statistical trend toward higher level of interleukin-6, which is a key pro-inflammatory cytokine, and a higher level interleukin-10, which is a key anti-inflammatory cytokine, in the patient that go on to develop persistent fatigue. So this somehow suggests that some individual, just you know, as a natural part of their biology, have a slightly activated level of their immune function, which then, when it's stimulated, go on to the, and these are the individuals that when the immune system is stimulated, in this case by interferon alpha, potentially in chronic fatigue syndrome case by an infection or an acute life event, but these individuals, because they have already a higher level of immune activation, then they go on to develop even larger response with more severe fatigue and persistent fatigue. They also, during treatment, IL-6 and IL-10 remains elevated in the patient that go on to develop persistent fatigue. However, in particular, very similar to what happened to the fatigue, acute fatigue symptoms, the elevation peaks at 4 weeks. So at 4 weeks, these individuals already are different in their immune response compared to those who do not develop persistent fatigue. So they're significantly higher at treatment week 4. So here's the, if you like, the graph showing what I've just said. That's the baseline level of IL-6 before starting interferon alpha. You can see that those who go on to develop persistent fatigue already have higher level compared to those who don't. During interferon alpha, everybody goes, all the IL-6 and everybody goes up, but those with they go on to develop persistent fatigue and have also higher acute fatigue, also have a higher interleukin-6 response. It remains higher throughout interferon alpha treatment. But what's interesting is that the level of interleukin-6 goes back to this normal during the follow-up. So this is the time the interferon alpha stops, and the level of interleukin-6 decrease in both groups, and they go back to similar level in both groups. So in other words, here at the follow-up, where this group in red have higher level of fatigue, there's no longer any difference in the interleukin-6 levels. So at the time where the symptoms are, if you like, the most interesting one, because they are present and they're persistent, the immune system is no longer activated. Whatever has created the fatigue here during the first 3 to 6 months of treatment is no longer present in terms of immune dysfunction. However, probably downstream of the immune dysfunction, things are still activated. And that's the next things that we want to understand. Exactly the same things happening with interleukin-10. Higher level at baseline, so these people have already a higher predisposition to developing, so they already have a slightly higher activation of the immune system, a much larger response to interferon, a much higher response to interferon alpha. In fact, with interleukin-10, there's virtually no changes in patients that don't develop fatigue. But those who develop acute and then persistent fatigue have a really high response. It remains elevated throughout the treatment. However, again, it goes back to normal. So also for interleukin-10, there's no difference anymore at the time that this patient still have persistent fatigue. Again, consistent with the notion that something happened early in the course. If we want to use this to model, or to infer about chronic fatigue syndrome, that tells us that something happened early in the course of the illness, around the first few weeks or months after the trigger of the chronic fatigue syndrome in the immune system, which is no longer present 6 months or 1 year or 12 years after when actually we are studying the patient with chronic fatigue syndrome, at least with these specific cytokines that we are measuring. Now, we've measured other cytokines. Some cytokines like interleukin-2, 8, 17A, and TNF-alpha are responsive to interferon alpha, so they do change during the treatment with interferon alpha, but they change the same way in both patients that develop persistent fatigue and patients that don't develop persistent fatigue. In other words, they respond to the immune challenge, but they don't seem to be related to fatigue at all. And other cytokines like interferon gamma, IL-12, P70, and IL-13 do not change with interferon alpha, so are perhaps not targeted by these cytokines. So, if you like, the conclusion of from this finding is that inflammation has resolved to similar levels as pre-treatment 6 months after treatment, even if patients continue to experience persistent fatigue. So the early response to the trigger is particularly important in determining the outcome for persistent fatigue. And this can also explain why, of course, there have been so many inconsistent findings when measuring immune system at the time of the diagnosis of chronic fatigue syndrome, or sometimes when patients have been ill for many years, just because perhaps the immune dysfunction is no longer there. Downstream pathways are still activated, and we want to look at that now. We have samples collected for transcriptomic analysis, which will tell us what other biological changes are present downstream of this immune activation, but the immune activation is no longer present. We also looked at the kynurenine pathway. The kynurenine pathway is part of the immune response, is a downstream component of the immune response driven by the metabolism of tryptophan. But again, we found no difference either across time or at the time of the follow-up between those who develop persistent fatigues and those who don't. I want to show you then this slide. This is the direct comparison between the 4 groups that I mentioned. So the control, from the left to right, this is the IL-6 level, controls, the resolved fatigue. So these are the patients that have had experienced interferon alpha and now, 6 months later, are no longer fatigued. The persistent fatigue, so these are the patients that have taken interferon alpha and are now still fatigued, and patients with chronic fatigue syndrome. And as you can see, paradoxically, the control and the chronic fatigue syndrome patient have indistinguishable level of IL-6. So this just confirms one more time that even in our hands, we cannot detect higher level of inflammation using IL-6, which is potentially one of the most important pro-inflammatory cytokines. We cannot detect high level of inflammation in patients with chronic fatigue syndrome. And if anything, and also you can see here, we cannot detect any difference between patient with the patient with hepatitis C that have resolved their fatigue or have persistent fatigue. But if anything, these groups have a higher level of cytokines, probably as a consequence, still an ongoing consequence of the initial immune stimulation. But there's no effect in chronic fatigue, if you like, in pure diagnostically chronic fatigue syndrome. And that's the same for interleukin-10, exactly the same picture. Showing once again, at least in our hands, as in many others, that there is no immune activation, or there is no clear immune activation with the cytokines in patients with chronic fatigue syndromes, years, of course, after the illness started. And consistent with this, there's no difference in those who are persistently fatigued. This is the group that is, in fact, if you look at fatigue level, of course, the chronic fatigue syndrome are very fatigued. The persistent fatigues are similar or not as severe. But there's no relationship between between the inflammation levels and the fatigue level at that time. Everything happened really early in the course of the illness. And this is the main, if you like, take-home message, that we really need to try to understand what's happening in the immune response around the trigger of chronic fatigue syndrome, the ME. And perhaps later on, it may be more difficult to understand. Thank you very much for your attention.